Hello, everyone. This is Mark Anthony with AI Edge Promotions and Podcast. We're here to bring you the best of the best doctors that are in their niche and with what they do in their lane. Today, we have a special guest, Dr. Brett Hightower. Today, we're going to be talking about something very interesting, and I love this title, Doctor of Drugless Methods. How many doctors have you heard that talk about drugless methods? Of course not. We're inundated with every news outlet out there that talks about use this drug, have this drug. This will help you make you shorter, smaller, taller, wider, whatever you want. But if you would like to get more information, you can go to Hightower Acupuncture and Laser.com. Dr. Brett Hightower, with over 30 years of dedicated practice, Dr. Brett Hightower brings unparalleled experience in holistic healing and energy medicine. A Raleigh native, Dr. Hightower began his journey by studying biology, chemistry, and quantum physics at Appalachian State University, graduating in 1984. Hey, that's a great year. That's when I think Michael J. Fox came out with Back to the Future. His passion for alternative healing blossomed during the exciting emergence of the integrative medicine in the late. He's deeply influenced by visionaries such as Deepak Chopra, Andrew Weil, Bernie Siegel, graduating summa cum laude from Life University's chiropractic program in 1993. Dr. Hightower began his professional journey by teaching X-ray physics and advanced diagnostic imaging, publishing his practice in Raleigh in 1994. He quickly expanded his expertise by becoming a certified in acupuncture in 95, the class that I graduated. Dr. Hightower's decades of combined experience in chiropractic and acupuncture have provided a profound understanding of how energy flows and heals the body. At his practice, you're going to benefit from Dr. Hightower's lifelong dedication to combining ancient wisdom with cutting-edge science, all within a welcoming environment committed to your well-being. So everyone here, as we go forward today, we're going to be hitting on some really deep questions on the healing of the body. We'll be talking a little bit about electric acupuncture, insomnia, carpal tunnel, and also, of course, neuropathy. Thank you so much, Dr. Hightower, for being here.
Thank you, Mark. It's my pleasure.
Yeah, tell us your story. How old were you when you decided to get into this type of regenerative medicine or this type of industry of helping people? Where did it start?
Well, real briefly, I was pre-med at Appalachian, and I was working at a hospital to further my progress in that area. And it just occurred to me one night, I had this epiphany. It's like, wait a minute, everybody here is sick. The doctors are sick, the nurses are sick, the patients are sick. Now, it was a small hospital in the mountains of North Carolina, and I had a kind of a small sample size, but it just occurred to me that that's not what I wanna do. So I went ahead and got my degree and started working as a chemist at NC State for a little while and kind of figuring out, which direction I wanted to take it. I liked working in chemistry. I was with the poultry science department of NC State. I liked it, but the problem was there was not enough people. I was always by myself in a research capacity, and it was very bothersome to me. I couldn't put my finger on it at the time, but then I quickly realized, well, there's just not enough people in my life. So I moved to Hawaii, actually, with my then girlfriend who became my wife. We picked up and moved to Hawaii just to do something different. And it was an interesting time to be living in Hawaii. It was like, as you mentioned, the beginning of the Deepak Chopra and really the blossoming of alternative medicine, and Bernie Siegel and Andrew Weil and all these names were just really hitting the television circuits and hitting their stride. And it caught my eye. And I went to a Bernie Siegel seminar because one of the interesting things about Hawaii is people that can sometimes go there and give seminars that are given, they're packing huge seminars, but they'll go to Hawaii and do it in a little room to get a tax break. So that's what he did basically. There was maybe 20 people there, and he was very famous at the time. And so he and I got a lot of chance to talk. And it sparked my interest in there's got to be a better way than pushing drugs towards everything. There's got to be a better way. I decided I didn't want to be a MD, but I could find other ways to do it.
Right.
And I actually started studying acupuncture first. And I met Serge King, who was a Hawaiian kahuna. So I was kind of shopping through different, sub-modalities. I decided chiropractic was a great segue for me because I had, some academic rigor in my background. I was chiropractic is the more established in terms of how the colleges are positioned, and it's very linear. Chiropractic is a very straightforward thing. So, whereas I looked into acupuncture at the time, I found it to be very esoteric and hard to understand. But I found chiropractic to be much more, I can understand how a bone putting a pressure on a nerve changes nerve function and changes health. That's a very direct line. So I decided that I would move my wife then at that point, and I moved from Kauai to Atlanta
Wow.
and started studying chiropractic. Saw more cars in one day than we'd seen in 2 years. It was quite a traumatic transition, but yeah,
Yeah, do
nonetheless,
what you
it
gotta
was
do.
great and glad we did it
Boy, wow. Big difference from Hawaii to there, I tell you.
for sure.
So let's talk about this, we're talking about this drugless method. Let's, you know, that our title is basically focusing on not working with drugs, but our main title is against using drugs. I mean, are we truly against using drugs? I mean, what is the drugless method? I mean,
Yeah, let
the
me
drugless method,
explain.
what does that mean?
It's a good question. I'll be solid and come out first. Say, there's a place for drugs. There is a place for medicines. God bless the surgeon. God bless the prescribing physician.
Yes.
It's just that drugs aren't everything. It's become, doctors of medicine are doctors of medicine. They're MDs. They study medicine. They're great at it. I go to one. God bless them. I use some medicines. Things happen, but it's not everything. We're primarily energetic, actually, and that's kind of the tie into acupuncture and chiropractic, which we can talk about in a minute. But we're primarily energetic, and these days, with the discovery of quantum physics and the advent of quantum biology and the role that the mind can play in our health, we're really moving much more towards that. Medicines have a place, but we need each patient's personal responsibility to learn to study other ways to be healthy. And that's what I try to do to guide those journeys. And to my role, the way I look at it, Mark, is I have the scientific background and the research background to say, okay, this makes sense and this doesn't. Because there's a lot of nonsense out there too. So I can help people steer people more towards the therapies that make sense. And then finding where, what is the key for their particular healthcare conundrum and help them unlock it and get healthier. That's what my expertise is in.
I love that. So let's dive in just a little bit. So you do acupuncture. What
I
is
do.
there anything? Is it acupuncture and something else? Laser? I also know that we're looking at laser.
Yeah, and let me
What's the
backtrack a
secret to it?
bit.
Yeah, I would like to hear that.
As I told you, I found acupuncture to be very esoteric when I first started
Uh,
studying it. Then as I was really studying disease, what really woke me up to a lot of, what's happening is the study of the autoimmune processes. Because if you take all the autoimmune processes, and there are a lot of them, and you can take a comprehensive list of symptoms of each of them, you will find out there's a tremendous amount of overlap. And so what that said to me was, well, maybe they're just different manifestations of the same problem. So maybe there is a way to look at stuff. Maybe I can open my mind to new ways of, that things that I hadn't thought about before. And that kind of led me back to acupuncture and the study of acupuncture. So I got that degree, as you mentioned, 95, 96, and in Kansas City, and started studying traditional acupuncture, and have done it for 30 years. In my opinion, traditional acupuncture language is somewhat dated. They talk about things like liver heat and wind energy, have too much wind in your lungs or too much heat in your lungs. And that's a legitimate way to look at it. It's as legitimate as saying the bacteria causes your cold when there's bacteria around us all the time, and only some people get sick, and only some people get, badly sick from it. So it can't be just the bacteria. There has to be more to it. And so that's a legitimate way to look at it, the germ theory of disease, as they say. But then based on that discussion of autoimmune processes, I really opened up to the fact there's got to be, it's okay to talk about liver heat or lung heat as a cause of disease. Maybe that's a legitimate way to talk about it too. But it's very hard to explain to people. And it didn't really resonate with me. And mostly when I talk to other physicians, it's hard to explain from an acupuncture perspective what that means. So lately I've become very excited about new developments in acupuncture, what I call neuropuncture, or what is called neuropuncture. And neuropuncture is a form of electric acupuncture that is neurologic based and research based. So now if an OB/GYN wants to talk to me about the treatment of infertility, instead of saying, well, there's too much damp in the uterus, I can say things like, These are the nerves. These are the nerve supplies into the uterus. These are the nerve supplies into the ovaries. These are the voltage and amperage patterns that they work at. So this is the pattern that I'm using to affect nerves in this way. And they go, oh, so a lot of it's the same points and the same acupuncture. The process hasn't changed that much, but the language around it has changed a lot, and it has become much more easy to explain to the patient and to the any physicians that I'm talking to, which I like a lot.
Wow. My question to you would be for acupuncture, when you first started using acupuncture, what was the aha moment for you? See, I know for a fact you wouldn't be doing what you are doing if there was not an aha moment of when the light bulb just turned on.
Yeah, with acupuncture particularly is watching pain relief because that's most of what I was using acupuncture for at the time. It's like, wow, this really works when you do acupuncture for pain relief. When you have somebody that comes in and says, in fact, I can think of I had an attorney here in Raleigh that I've seen everyone from my shoulder. I've done everything, nothing helps. And I was working on him chiropractically. And I said, well, let me do acupuncture. And it took his shoulder pain away. He was amazed. I was also amazed. And it kind of woke me up to that. There's something really powerful here and something that could be explored. So with that, let me transition to the laser as well, talking about laser because you had asked about that. Because what we're, like I said, it's all about energy. It's all about, energy is a term people often think it's like woo woo, like, woo energy medicine. It's quantifiable, it's measurable. It's not woo woo. It's quite precise. And one of the manifestations of that is involving laser therapy. Laser therapy is amazing. I've been doing it for 20 some years. Actually gave a talk to the UNC neurology department about 15 years ago to the use of lasers in neurology. And that's when I first got into it. We were using what's called a class 3A laser. Now I have a class 4 laser, which you might notice on the table behind me there. And what the laser therapy does that's so profound is it causes the mitochondria to resonate. Mitochondria is like a stacked set of membranes, encapsulated set of membranes. And if you've ever seen a TV antenna up on the roof like we used to have back in the day, so what do they look like? There's a set of poles that are a certain distance apart. And what the television signal or radio signal has to do is line up with that frequency. And that's how we can use laser light, specifically 4 different frequencies of laser light to resonate and to hit that antenna array of your mitochondria to make them resonate. And when it does, it increases metabolic efficiency. It's called photobiomodulation, and it increases metabolic efficiency about 1,000-fold. So the point is, it functions like an anti-inflammatory, but instead of being a steroid or a chemical that you put in your body, it's your own cells doing it. And so the laser's applied to the tissue. It increases photobiomodulation, an effect, by the way, that lasts about 24 hours. So that anti-inflammatory effect, the pain relief effect comes down, and people start healing much faster. Almost all pro sports teams use them now. I wouldn't practice without one. They're quite profound and a lot of fun to use.
When you do that, does it activate any cells that are maybe dead or maybe just not functioning right? Maybe that's a better word.
Yeah, if a cell's dead, a cell's dead. The body's always turning over, forming new cells, forming new energy, and it's we in fact our bodies are much more dynamic than we used to think in terms of how molecules move and cells change. And we're
Oh, it's
always
forming new
regenerating.
cells, forming new
Always regenerating, yes, so you're gonna speed that process up with virtually every type of cell. There's, great vet studies showing laser light therapy helping with bone regeneration post-fracture too, so it's quite fun to work with. So, yes, almost any type. But for a nerve specifically, nerves, the way a nerve works, it has a cell body, it has long axons and short dendrites that go out and, receive information and transmit information, right? That's how a nerve works. If that cell body is dead, like as in, Christopher Reeve or a fracture where the people never walk again, that's done. That cell's not going to come back to life. God bless you. Adapt the best you can. But if the cell is only compromised or pinched somewhere along the way, or not getting enough nutrients, not getting enough
blood
oxygen,
flow.
then yes, the manipulative therapy, the chiropractic can really help, and the laser therapy will really help as well.
Oh, wow. So interesting. So that's good to know. When we're looking at, there's really no such thing. So if they're dead cells, they're dead cells. But the good thing about with what you do, it helps replenish where there's more that are actually coming alive. So that inflammation literally kind of goes away or it gets stronger in that area with something that's more touchable alive.
Yeah, with inflammation specifically, you just metabolize through it faster. Inflammation is acidity. It's an acid buildup. And so your body is always, it allows your body just to chip away at that acidity faster. And inflammation, is kind of, we're realizing kind of the granddaddy of most diseases. Most chronic diseases are inflammation based. So again, we want to, as a patient, as an individual, you want to learn how to avoid inflammatory conditions, how to meditate, how to exercise, how to do things that don't just, aren't just pesky thing the doctor's telling you to do, but it's choices that you're making to decide you want to live as healthy and as full and long as and productive life as possible. So that's again, a lot of that is around inflammation, and the laser is very helpful with in decreasing inflammatory conditions.
Awesome. Let's talk a little bit about electric acupuncture. I mean, is it what do you when you throw these needles in someone's body and then will you just turn the voltage up and just shock the heck out of them? How does that work? Can I just the way I see it, my brain.
Well, they're actually some very small amounts of current, because what you're doing is matching the nerve.
Oh,
So, there's basically 4 types of nerves, and they have different diameters and different levels of insulation, 4 types of pain nerves. They have different radius and different levels of insulation, so we have different voltage and amperage requirements to get that nerve to heal, to get it functioning better. An interesting thing about how nerve works, Mark, is that in a resting state, a normal what we call resting potential, the inside of the nerve is negative and the outside of the nerve is positive, has a positive charge. And then the way the conduction, way signal transmissions happens is these little channels open up in the nerve and the polarity reverses. And that polarity reverse is the charge that is the transmission of a nerve signal. And then the polarity goes back. However, if a nerve has been hyperstimulated for a long time, like in pain or under long-term stress, what happens is that polarity gradient is not maintained. It's called hyperpolarization. And so the nerve doesn't really know how to act. It's always right at what we call at threshold. So like a nerve that's always painful. One good example is if you ever have a little muscle in your face or a little muscle in your eye that starts twitching, that's a nerve that's right at threshold. It's flickering back and forth across that threshold. So what we want to do is reset that gradient to get the normal resting potential restored so that the nerve effectively turns off. That's how electric acupuncture works in a nutshell. Also chiropractic, because if a nerve is pinched, physically impinged, then chiropractic, the same thing happens. That same nerve pathology happens. So let me bring this part in if you don't mind. So the tie-in between chiropractic, in my opinion, chiropractic is like essential. Everybody needs to get their spine adjusted. It's just like dentistry. You don't do it because your teeth hurt. You go to the dentist because you want to keep your teeth healthy. You want to keep your spine and your nervous system healthy. That's what chiropractic is about. Most people think of it as pain relief. Most chiropractors treat pain relief, and it's very good at it. But that's not all it does. Chiropractic is the foundation, what we call the macro level of electric interference, pinching of the spine. Acupuncture is more of a microcosm or micro level. It works on much smaller signals. It works on 25 milliamps or 25 microamps. Let me say it this way, microamps or milliamps. And 1 amp runs a light bulb, basically. So we're working on a thousandth or a millionth of what runs a light bulb. Very small charges.
wow. So have you seen where you've had a patient that has come in, say, we'll just use something as back pain, where he's just totally numb and there's those cells are just basically he's dead. He's been in pain, say, that's probably more of a neuropathy issue, I'm guessing. How would something like that help stimulate those cells where there's just numbness there, or is that pretty much far gone?
Okay, so good question. Neuropathy in particular is where the nerves are basically they're feels like pins and needles. They're numb or they're originally like pins and needles, and those nerves are not functioning. They are often from long-term oxygen deprivation, like in diabetes. Classic is diabetic neuropathy of the feet. So we want to restore blood flow. We do that with laser therapy or red light therapy, which is red light therapy is basically class 3A laser. So it's a smaller type of laser therapy, but it's very effective in getting the nutrients back and getting the blood flow back. You want to combine that with things that increase blood flow, like beets. Beet powders are very good at it. The green drink powders are very good at getting the blood flow restored. That signal system that they discovered when they were looking into Viagra, the nitric oxide signal system. That's what beets are about. And you can take beet powders and do red light therapy to restore or improve the functioning of the nerves in a case of neuropathy. But again, if that nerve is so far gone that your skin is getting crusty and your toenails are turning colors and stuff, it's a management. There's no cure coming. All you can do is slow the process down. And this brings up another good point, if you don't mind. Most conditions, because this is the tie in between Western medicine, drugs and drugless medicine. Most conditions, if you catch them early enough, will respond very favorably to drugless methods. A classic example is a cold. If somebody comes to me in the early phases of having a cold or the flu, and I do acupuncture and we get them adjusted, they'll almost always have very minimal illness. They don't get sick, or if they get sick, it's very mild. But if you get full-on flu where you're throwing up and it's got a hold of you, it's gotta run its course. At that point, there's not much that can be done, non-pharmacologically. And the same that applies to a lot of conditions like neuropathy, like carpal tunnel syndrome, like pinched nerves in the neck. If you catch them early enough, it's almost always effective. You can find ways to improve the nerve health and to decrease the pinching on it and to get it to be healthier. But if it's too far gone, you're gonna need surgery. You're gonna need, maybe screws in your spine. And again, God bless the surgeon. I have no problem with it. My point to the patient is the earlier you intervene in your health, the better it is. And just like with dentistry, if you intervene at a point where you think you don't even have anything wrong with you, then that thing won't develop and you will have much better health outcomes.
That makes a lot of sense. We're starting to hear a lot more about laser. What I wanted to kind of get back on but I feel like it's very misunderstood and not all lasers are equal. Correct me if I'm wrong, because I'm noticing, like, in workout places, join our laser room, and you just go into a module where you sit there and it does this laser thing on you that, you don't even know what's going on.
Yeah.
Are these
Yeah.
all the same, or they're just different? Are they all just
That's class 3A.
okay?
Class 3A is red light therapy. You don't feel any heat. It's effective. It's helpful. Some of those red light therapy rooms can be very helpful. But the lasers go up. Then there's class 4, which is the one like you see in the behind me there. It has to be run by an operator. It has to beep so because some of the beams are not in the visible spectrum. So it has to produce signals so that it's having infrared and ultraviolet laser beams that are doing their thing because you can't see them. And then those are both classified as cold lasers. And then there's hot lasers. Hot lasers are like for cutting, like surgical lasers. Lasers can be used for fat reduction. There's a lot of different uses for lasers. Mostly for pain relief, it's 3A and 4.
Okay, okay, that makes sense. But the type of laser that you're utilizing, the main
Yes,
difference.
it's a light cure. It's a light cure laser. I think it's the best in the business. And what makes it the best in the business versus some other class 4 lasers is the duty cycle is higher, which means it stays on basically. A lot of times lasers are turning off and on very quickly. You just don't know it. But to save energy and avoid it getting too hot, they've got a duty cycle where it's not always on. So you think you're getting a certain amount of joules of energy, but you're actually not. The This one is basically has duty cycles on all the time, so it has to have a fan running, it gets hot, it's a lot of energy, and that's why it's one of the more effective. That class 4 is the best in my opinion. There are some laser specialists who'll say class 3A laser is better. In
Right.
my experience, a considerable amount of experience, and in my opinion from the science behind it, I like class 4 lasers. I think they're much more effective.
Okay, that makes a lot of sense. So I noticed that you talk, or I've seen also on your website and from us talking to, using not just acupuncture but with laser. Why are these both at the same time? And if so, what's the significance of that and the healing process that you see and what it does?
Yeah, another good question. Sometimes we do use acupuncture and laser at the same time. A lot of it depends on the patient's preferences because they're billed separately. So if they say, I don't care how much it costs, I want to get well as quick as possible, we'll do both. Usually if it's just a local condition like a tennis elbow, usually we'll just use lasers, or plantar fasciitis, we just use the laser first. But for more systemic conditions like infertility or insomnia, indigestion, acupuncture is a better way to go. Again, that's my expertise in navigating which is the best way to start based on your particular health condition.
Okay,
So
awesome. So you mentioned tennis elbow. Does acupuncture is really good for that, or would that be more laser?
I would start with the laser because it's such a small area, such a small area. You just go right with the laser, much better. Again, I use acupuncture for systemic body-wide conditions and we start with the laser for local conditions. But here's why they're different technologies. They work differently. So they complement each other very nicely. Remember what the laser does is it increases cellular metabolism for all the inflammatory cells, for all the area that's in the laser beam. It penetrates 3.5 inches into the even in through bone. So it gets all the way down to a ruptured disc or to an inflamed facet joint. It gets all the way in there. So it speeds up metabolism, helps you get the acid soup of metabolism out of there quicker by increasing vascularity and blood flow. The acupuncture is different. The acupuncture is geared towards the nerve. With the acupuncture working specifically on the nerve, trying to get that nerve to reset out of that pathological pattern I talked about earlier, where the voltage potential is irregular. So we try to get that to reset so it stops hurting and works better.
So right now, where do you see acupuncture going? Do you feel like it's kind of picking up more steam, more people are kind of going more back to, I would say, I call it ancient. Acupuncture goes
Yeah.
goes
Yeah.
back to what I'm guessing with the 1600s, I'm guessing. Maybe.
Well,
No.
much farther back, goes back to a couple thousand years
Oh,
BC, actually, but
oh, wow.
in some form or another. But modern acupuncture is much newer than that. But basically, the theories have been around for a long time. They were using acupuncture in ancient China. So
Mhm.
some of the greatest texts were written BC, 500 BC. So it's a good question, though, because if you look first of all, I think people in America are really looking for they're tired of drugs. People want to find ways to do things that are outside of the drugs. Again,
Oh, they've
God bless.
tried them. They've tried them. They've tried the
Yeah.
they see
Yeah.
it's just getting worse and they're getting a higher dosage, not a lower dosage.
Yeah, and chasing symptoms with one medicine after another quite often. But so people are waking up to the fact that there's better ways to do things. But to answer your question, if you look at what's happening in the hospitals in China, they use acupuncture quite aggressively. The MDs and the acupuncturists work side by side. Most of these electric acupuncture developments in neuropuncture that I'm talking about are coming from hospitals in China. So I hope that we develop that pathway here, and it's happening at some places like Duke has an alternative medicine center that's using acupuncture. But in terms of the neuroacupuncture and using it with research, I'm not sure how much of that they're doing, but that's the way things are going. I'd really like to see acupuncture become more involved in like hospital settings and working with practitioners, medical doctors to help hand off. And this brings up an interesting point too. Like if a patient comes to me and they have really swollen lymph nodes and I think it might be cancer or something like that. It is morally, ethically, legally incumbent upon me to say, I'm not the doctor for you to see. You need to go see an oncologist or a GP or whatever. It ought to go the other way more than it does. So if you're at a back, like say back pain, you're an orthopedist doctor says, well, you're not a candidate for surgery. And a lot of times they'll send you to physical therapists, but they ought to also say you should try chiropractic and you should try acupuncture because this is not a surgical case.
Right.
Or you are not responding well to the medicine, so you should bring in these other modalities. And, I work with the VA, the vet, so it's happening. But I think that's the future. More of it is going towards the way where you'll see more and more people using acupuncture as not a last resort, but as a primary resort. Same with chiropractic, not a last resort. It's your first resort. And then, because you're any good natural, doctor of drugless methods, doctor, chiropractic or acupuncturist, naturopath or whatever have you, if they have a case, if they think that you have a condition that won't respond to what they're doing, they'll tell you and they'll get you going in the right direction. Just like any good surgeon will say, that's not a surgical case. Let's find you something else.
I like that.
So,
What would you do like for people that are struggling with, say, neuropathy? Can this be something that can really help out? And if so, how does that work? And I know each body's different, but what are,
well, yes, like I mentioned with neuropathy, that's a specific case where the nerves are dying. You got to figure out why the nerves are dying. And usually it has to do with circulatory issues. So it might be diabetes management, in which case you stay on your diabetes medication, but you also want to add in like vibration therapy, maybe, or red light therapy, or, like I said, the nutritional supplements to get blood flow restored, B vitamins and beet juice powders for the nitric oxide issue. Like we talked about, those things are really, really, it's a broad spectrum condition. You need to approach it from a lot of ways. And again, if you catch it early enough, will almost always respond. If it becomes very advanced, you're in a management situation, and you're kind of who knows? You roll the dice as to how well you do with
Just
that.
managing.
Yeah, just managing. That's all you can do. So, and the medicines are that way too. A lot of times, even with the medicines, they're just managing. They're not really. It's not going to cure anything. It's just managing it.
Yeah, we don't want that. That's gonna cost too much money. Joke. What would you right now, would you say, does your practice currently right now take insurances, or how does that work right now? Like if
The
somebody
the chiropractic component of the practice does take regular insurance. I only accept insurance from the Veterans Administration. The rest of acupuncture is cash practice because I've been doing it a long time. I have a large patient base, and acupuncture insurance is a pain in the neck. So I've chosen not to do it, but it's my services are worth it, and I would love to help people that it's worth it. People get in to the I know when you pay a lot of money for insurance, you wanna use it, but the fact of the matter is the insurance these days is not covering a lot. So a lot of times it doesn't really help you as much as you think. It's interesting as a side note, when I was in chiropractic college, the whole move towards it with the time called a Hillary care, but socialized medicine was happening. And we were trying to figure out, we were very afraid as students that the medical doctors were going to take our chiropractic business away. Well, that's foolish because what a chiropractor does is much harder physically on the doctor than what a medical doctor does. So it's very much easier to stand there and cut a script and try different things. And again, I don't mean to short them; they're good at it, but they're never going to become chiropractors or acupuncturists or physical therapists because it's a whole different skill set and it's harder, physically harder on the doctor than being a GP. I know surgery can be quite hard on the physician, but in general, that's the way things are going is more of a working together with teams, I think, to help us address it from all aspects, like neuropathy, and to avoid surgery and drugs.
No, I love it. What would you say for someone right now that is maybe kind of contemplating whether they're gonna maybe start going the acupuncture way, but they're really not sure because it's not something that's really widely spread and talked about?
Yeah, people often have, they just don't understand what acupuncture is. Like I said, it's quite esoteric in a way, the way the energy works. Energy medicine in general, people don't understand it. But what I would say is there's no downside. There's only upside. It's worth trying. Find yourself somebody who you trust. It's not usually the biggest practice selling, selling the back of the phone book and all that kind of stuff, or the biggest advertiser. It's the guy who you think serves out of love. Because that brings up an interesting point too, that one of the things that drugless medicine recognizes it comes into the equation that is not addressed well by most of traditional medicine is the intent of the provider matters. The attitude of serving and love matters. A lot of great doctors, but sometimes the corporate aspects of modern medicine make it difficult for even well-intentioned people to be able to do that. So you want to find somebody who serves out of love, who really listens to you, who gives thoughtful responses and doesn't mind questions. Do that. Look for that in a provider. But try acupuncture because it's simple. It balances the nerves. My opinion is get yourself adjusted first because that's the macro electric system. Get your spine aligned, and then as a part of that, if your condition doesn't respond to the chiropractic care, then acupuncture is the next step. Acupuncture is the microcurrent modulation where we heal the nerves at the micro level, and it's better if you have systemic conditions, like I said, like insomnia, indigestion, and infertility. I treat a lot of infertility, things like that. And you don't want more medicines, try an acupuncturist, and you'll be surprised at how well it works.
How long does acupuncture normally take? Was it like 15, 20 minutes, or is this
No, usually 30 to 45, depending total visit, 30 to 45, depends, and sometimes it's 20 sessions. Let's say 30 minutes, your average treatment time,
and you're
acupuncture.
looking about 20 to 25 sessions?
That's a good guess. It depends on the condition tremendously. Some people I had a tinnitus person, excuse me, vertigo person the other day came in, had tinnitus and vertigo actually, a little bit. Tinnitus is ringing in the ears. When they're together, it's called Meniere's. She had a little bit of both, ringing in the ears, a little bit of vertigo, and 2 treatments. I told her it was gonna take 10 to 15 and 2 treatments. She was done, and that's because she didn't wait. It'd only been bothering her for a few days, and she came in and got it fixed, and it just went right away. But it's not average. Typically, it takes about 10 to 15 visits to figure it out. And I do packages of 10, and the reason is it may not be completely cured after 10 visits, but it ought to be improved to such a degree that you don't care how many visits it takes because it's working, right? So the number once something's working, how long it takes kind of goes away. And so it's that 10 sessions is a good test period, and it should be responding. Like I said, it may not be as good as it gets, but at least it's heading in the right direction and you're happy with it. If it's not doing anything, it's incumbent upon me to figure out something else for you to do, a different modality or different approach to help you get the relief you need.
I have a question though. Like, did you ask her like what made you come into our practice to get acupuncture for your ear? I mean, it's not like just anybody just wakes up and says, "Okay, my ear's having a problem. I need acupuncture."
Well, yeah, in this case, I already knew her.
Oh,
She was a chiropractic patient from when I was practicing. I already knew her.
I was
So
like, "Wow."
she trusted me and said, I've got this new condition. And she had maybe a better answer to your question is she had gone and talked to her GP and he said what got her was she said, "Let's try," the GP said, "Let's try this." And she said the word "try" just didn't sit right with me. I didn't wanna try anything. I wanted to fix it. So, she thought, well, like I just mentioned to you, she thought, "Well, it can't hurt to try acupuncture. Why don't I do that first?" And so with that condition, the needles go in front of and behind the ear, right below the earlobe, and then down in this point in the hand. And we use very specific nerve frequencies. I'd tell you what they are, but I have to kill you if I did, so I won't do that. But we use those particular frequencies to heal the nerves, to reset them. And like I said, 2 visits later, she's pretty much done with it. But that's quicker than most.
Wow, that's amazing. I actually want to try it on my arm now. It's not bad, like I said. It's just, I want to get it to at least 95%.
Yeah.
I just got a new paddle, so I'm ready to I'm ready to explode. I'm like, come
People
on.
that love pickleball.
Oh my god. Oh no, I'm like, I'm addicted to this stupid little. It's so funny because before I started playing, I used to play tennis all the time. I used to be a tennis pro, and was ranked when I was a kid. And it's funny because I used to make fun of people. I was like, oh, that's for old people. But COVID blew it up. All the young
Yeah.
people started playing it, and then they blew that up, and now everyone just is all pickleball. Andre Agassi, Pete Sampras playing pickleball.
Yeah, yeah. It's great fun, great fun.
Yeah, and hey, well, now they know they need acupuncture if they're in a little bit of pain.
Yeah, or laser in that case too.
Laser,
Remember, I keep saying with your elbow, try the
inflammation.
laser first. Try and get your elbow adjusted. You wanna get it adjusted because it can be a misalignment issue. So if your wrist is also especially if your wrist and your elbow bother you, that's indication that it's likely skeletal, but you wanna get your wrist and your elbow adjusted first and then go to the laser, and then if the laser doesn't work, acupuncture, in my opinion, will be third line of defense for that.
Yeah, I think I go for the hour massage. But anyway,
Yeah.
exactly. Well, thank you so much, Dr. Brett Hightower, for being here. If you could let everybody know where you're at, where people can find you, maybe also the phone number. We also have that on the screen, but just maybe if you kind of give that information
Yeah,
out.
thank you. I'm in Raleigh, North Carolina, 931-3. My website is Hightower Acupuncture and Laser.com. Love to help you out. I love answering questions. If you want to just shoot me a text or shoot me an email, I'm happy to, because a lot of people don't live close enough to come see me. I'm happy to answer questions and point you in the right direction. And if you do live within the state or Southern Virginia, come on in. I'll hook you up.
Awesome. Well, thank you so much for being here. Love your passion for acupuncture and staying on the cutting edge. It's so funny. I always tell people the old is the new. Sometimes
Yes, it's
the old
true.
is the new. And new is the new.
Wisdom's coming full circle.
100%. Sometimes we skip all these blocks and not realizing that.
Yeah,
Right.
and one more thing about that,
Yeah.
if you don't mind, quantum mechanics, modern physics, modern physical understanding of the universe is pointing back to the role of belief and the role of your mind in healing, and that is really ties it all together, and, acupuncture can help I can help you with that, help get your mind in the right direction, help you with affirmations, help you with a mental mindset. People say, "I have a bad back." Don't say you have a bad back. Say, "My back hurts me right now, but it's gonna get better," and it allows the chance for healing. So we wanna open our minds to the effect of how we can heal using our thoughts.
I like the way you say that, and a lot of people kinda make fun of that, and they don't realize that, it's actually a biblical thing. What you think is what you become. So if
Yeah.
you keep saying, "Oh, I'm in this, or I'm this, or I'm that," well, guess what? You
Yeah.
become that,
It
and
becomes your
you're
reality,
telling your
exactly right.
computer the most unbelievable AI, which is a real brain, is what you tell your computer to do, what you tell your mind to do, it will do,
There
so
you go.
words are powerful. Funny, we were actually talking about that last night. Words are very powerful, and that's something that we all need to work on and need a checkup.
Yeah. Yeah,
But,
in this case, AI would be axonal intelligence.
oh boy, I know. Oh, that's another podcast.
Well, I hope we do get a chance to.
Think we will. I appreciate you, Dr. Hightower, and I look forward to seeing more people look at alternative methods and not just one method, not just a pill that they think that's just going to help them. If people really want to get better, it's good to try things in doses. Laser is something that's great because it helps bring down the inflammation. But I like what you said. You said go to first, get adjusted. Why get adjusted? Spine, very important, helps with the blood flow. And then from there, little bit of laser, and then, hey, let's back it up with some needles with acupuncture.
Acupuncture, yeah, exactly.
I love it, and thank you so much, doc, and I look forward to talking with you again.
All right. Thank you, Mark. Take care.